Well, we're right smack in the middle, well, give or take, of Mental Health Awareness Month. That's the month of May. And for the last many years, we have been teaming up with our friends over at Lamoille County Mental Health Services, in which they, every Tuesday, talk about some of the services that they provide, some of the people that provide those services. And Monique Reil with us this morning. She is the Mobile Crisis Team and ASAP Manager. Boy, that sounds like a lot to put on your door for your office number there. Monica joining us this morning. Now, did I pronounce your last name correctly, Reil?
Yes, you did.
Okay. Yeah, you would think that the number of times that we talked that I'd be a little bit more confident about your name there. But good to have you back with us for Mental Health Awareness Month. So what does that mean, being a Mobile Crisis Team and ASAP Manager? So what do you do at Mental Health Services?
Boy, that's a great question. We all wear a lot of hats here.
Yes,
and it's great to be back here with you, Roland.
Thank you.
Our Mobile Crisis Team is our 24/7 team that is available to everyone in Lamoille County for any variety of supports around mental health. And our ASAP program is a public inebriate program. So folks who are incapacitated in the community because they've been drinking or using drugs and are not able to be safe can come and stay at our program after we have met with them. So they can stay there until they get sober, until they have a safe place to go. So that is another service that we provide.
Mm-hmm. What are some of the other emergency services that you come across that you provide, at least through your office? Well, I mean, I guess it's a whole team effort, actually.
It is a team effort, and feel really fortunate that we have a great team of staff who are able to help. So basically, any time of day or night, if someone needs some support because they're feeling depressed, feeling anxious, just having trouble coping, and there's so many things to cope with, especially with COVID still hanging on these days. Our team's available by phone to talk with people. We also meet with people at the hospital. If someone is really needing a higher level of care, we can make referrals to crisis bed programs or inpatient units at hospitals if people need that level of care. Another thing we do that we don't get asked to do very often, but sometimes, is we're able to do debriefings for folks in the community. So if someone has had a loss at a school, loss of a student, loss of a teacher, just some public events that are really challenging for people to process, we're able to go on site and provide some support and debriefing for those folks. So we've done that at schools, we've done it at local fire departments, daycare centers, with a variety of groups of people, and that is something that we're also available to do.
Do you find that folks aren't aware that that you do provide these types of services? I mean, folks, everybody has, has issues and things that they have to deal with, and sometimes just not knowing where to go to. Do you find that still that mental health services, sometimes you can be a bit of a best-kept secret?
I think we still are to some extent, although I think that has really changed. I think more and more people are getting to know who we are and what we do and how to get a hold of us. And one of the things we're really fortunate with is that after hours, we have a really easy phone number for people to remember. We are dispatched through Copley Hospital, and their number is all eights, except for having to dial 802 first, and then it's 888-8888. So very simple number to remember when you really are struggling and need someone to talk to.
And that number is available 24/7?
That is correct.
Okay.
Yes. On weekdays, there's usually one of us in our office, so people can also call our office number, which is 802-888-5026. And if people get the voicemail when they call that number, it does direct them to call the hospital if it is a crisis or emergency.
Well, certainly good information for folks to have on their refrigerator, to have nearby, so they can refer to it rather quickly, because emergencies do sometimes come up in just a flash too, and you just don't, and you just need to have that number handy. So it's good to know that. All right, and
yes.
also you wanted to talk about an event or a program in Craftsbury you wanted to mention.
Yes, I wanted to highlight something new that is happening this year in the Craftsbury area called the Yellow Tulip Project. So this is a project that has national roots through NAMI, which is the National Alliance for Mental Illness. And Craftsbury has had a group of just community folks called the Craftsbury Mental Health Resource Group, and they have sponsored a variety of education and support activities for the town of Craftsbury and the surrounding area. Last fall, they planted 500 tulip bulbs, yellow tulip bulbs, with little signs next to them called Hope Gardens. So these are small gardens planted specifically with yellow tulips, with the idea that these tulips bring hope and happiness to people. Specifically around suicide prevention, but just in general, too, for mental health support. So we planted those bulbs last fall, and this year, perfect timing for May, Mental Health Awareness, all the tulips are in blossom. So if anyone has a few minutes that they don't know what to do this weekend, I would say, please take a ride around Craftsbury and Craftsbury Common and see how many Hope Gardens you can find. Take some pictures. They're really beautiful.
It's almost like a contest.
Yes. I believe they are on Facebook, and I'm sure you can circulate some more pictures on Facebook and spread the word. I think these days we really need as many signs of hope as we can. We've been through some dark days with COVID and things. Just as things seem to get better, they kind of take a downturn for the worse again. So it's really important that we have visual things we can see that bring us hope and remind us that things will get better.
And nothing brings hope better than spring and spring flowers, that's for sure.
Absolutely.
Especially since spring has actually arrived in Vermont this time. You know, May can be all kinds of different types of weather, but fortunately we've had more spring weather than we've had in other springs, that's for sure. So
that's true.
Okay, so if you want to find out more again about the services of Lamoille County Mental Health, you can call them. The office number, give me the office number again.
It's 802-888-5026.
Okay.
And we also have a great website that's very simple to remember. It's Lamoille, LAMOILLE.org.
Perfect. All right, Monique Reil, it's always good to talk with you during Mental Health Awareness Month through the Lamoille County Mental Health Services. And again, you folks, all of you do such great work and continue the great work. And we look forward to talking to Amy Fitzgerald next week during the Mental Health Awareness Month. Thank you, Monica.
Thank you so much, Roland.
Okay.
Take care.
You too, thanks. That's Monique Reil from Lamoille County Mental Health Services. Mental Health Awareness Month, the month of May.